Welcome. I'm Dr. Thomas Gerber, one of the Associate Editors of Mayo Clinic Proceedings. In this recording, I would like to review for you the articles that our Editor-in-Chief, Dr. William Lanier, has chosen to be featured on the cover of the August 2012 print journal, along with the accompanying editorials. The article, The Princeton 3 Consensus, Recommendations for the Management of Erectile Dysfunction and Cardiovascular Disease, was authored by Dr. R.J. Nera from Mayo Clinic in Rochester, Minnesota, and colleagues from many other national and international healthcare institutions. The Princeton Consensus Expert Panel Conference is a multi-specialty collaborative tradition dedicated to optimizing sexual function and preserving cardiovascular health. The Princeton Consensus from 2010 had two primary objectives: the evaluation and management of cardiovascular risk in men with erectile dysfunction and no known cardiovascular disease, and second, the re-evaluation and modification of previous recommendations for the evaluation of cardiac risk that is associated with sexual activity in men with known cardiovascular disease. The panel's recommendations emphasize the use of exercise ability and stress testing to ensure that each man's cardiovascular health is consistent with the physical demands of sexual activity before prescribing treatment for erectile dysfunction. The recommendations also highlight the link between erectile dysfunction and cardiovascular disease, which may be subclinical or asymptomatic and may benefit from aggressive cardiovascular risk modification. This month's Editor's Choice is a truly groundbreaking collection of commentaries on the concept of Medicare accountable care organizations. In this collection, organized by our section editor for healthcare policy and epidemiology, Dr. David Ballard from Baylor Healthcare System in Dallas, Texas, representatives of several U.S. healthcare delivery organizations discuss why their institutions did or did not choose to participate in the accountable care organization component of the Medicare Shared Savings Program that is meant to reduce healthcare costs while improving healthcare quality. Dr. Ballard provides an introduction entitled The Potential of Medicare Accountable Care Organizations to Transform the American Healthcare Marketplace, Rhetoric and Reality. The collection continues with an overview from Dr. Len Nichols from the Center for Healthcare Policy Research and Ethics at George Mason University in Fairfax, Virginia, entitled Accountable Care Organization Pathways, Diverse but Ultimately Parallel. The representatives presenting the perspective of various healthcare institutions include Dr. Raymond Anderson from Ascension Health Partners in St. Louis, Missouri, Dr. Craig Milford from Massachusetts General Hospital, Dr. David Shulkin from Morristown Medical Center and Atlantic Health System Accountable Care Organization in Morristown, New Jersey, Dr. Carl Crouch from Baylor Healthcare System in Dallas, Texas, Dr. George Meisel from Health Choice in Memphis, Tennessee, and Robert Porter, a doctor of jurisprudence at SSM Healthcare in St. Louis, Missouri. A video interview by Dr. Ballard with several of the contributors can be viewed on the homepage of Mayo Clinic Proceedings. The review article entitled Long-Term Medical Management of the Liver Transplant Recipient, What the Primary Care Physician Needs to Know, was authored by Dr. Siddharth Singh and Kimberly Wyatt from Mayo Clinic in Rochester, Minnesota. Recognition, management, and prevention of medical complications and comorbidities after liver transplantation is the key to optimal long-term outcomes. Primary care physicians have an important role in improving the outcomes of liver transplant recipients and are increasingly relied on for managing these complex patients. This review article is meant to assist the primary care physician in the long-term management issues of liver transplant recipients. The original article entitled Vasculitis Associated with Tumor Necrosis Factor Alpha Inhibitors was authored by Dr. Alayemi Sukambi and colleagues from Mayo Clinic in Rochester, Minnesota. The authors describe the clinical characteristics, histopathologic features, and outcomes of 8 patients who were diagnosed at Mayo Clinic between 1998 and 2011 as having vasculitis induced by TNF-alpha inhibitor therapy. Cutaneous small vessel vasculitis was the most common finding, but systemic vasculitis, including peripheral nerve and renal vasculitis, was also frequently observed. A video interview with Dr. Sukambi can be viewed on the homepage of Mayo Clinic Proceedings. The article "Severe Sprue-like Enteropathy Associated with Olmesartan" was authored by Dr. Alberto Rubio Tapia and colleagues from Mayo Clinic in Rochester and several international healthcare institutions. The authors report the response to discontinuation of olmesartan, an angiotensin II receptor antagonist that is commonly prescribed for the treatment of hypertension, in patients with unexplained severe sprue-like enteropathy. The 22 patients included in this report were evaluated at Mayo Clinic for unexplained chronic diarrhea and enteropathy between 2008 and 2011. The average age was 70 years. Tissue transglutaminase antibodies were not detected, and a gluten-free diet was not helpful. After discontinuation of olmesartan, resolution of symptoms and a mean weight gain of 12 kilograms was demonstrated in all patients, and histologic recovery or improvement was found in all 18 patients who underwent follow-up biopsies. The authors conclude that olmesartan may be associated with a severe form of sprue-like enteropathy, which responds favorably to discontinuation of olmesartan. A video interview with Dr. Joseph Murray from Mayo Clinic in Rochester, Minnesota, one of the authors of this article, can be viewed on the homepage of Mayo Clinic Proceedings. Again, please be reminded that authors or co-authors of 3 of the articles we have discussed, Dr. Spallard, Murray, and Sukambi, have provided video interviews. These interviews are available on the homepage of Mayo Clinic Proceedings at www.mayoclinicproceedings.org in the upper right-hand corner. There you will also find additional video interviews on articles entitled "A Prospective 1-Year Follow-Up Study of Postural Tachycardia Syndrome", on "Wireless Fast-Scan Voltammetry to Monitor Adenosine in Humans with Essential Tremor During Deep Brain Stimulation", and "The Hygienic Efficacy of Different Hand-Drying Methods", a review of the evidence. Also on the website, our series entitled "Meet the Mayo Clinic Proceedings Editorial Board and Staff" this month features Dr. Lori Erickson from Mayo Clinic in Rochester, Minnesota, who has been on the editorial board for many years and was recently named Associate Editor. As you know, you will also find on our homepage additional content that is not available in the print journal, such as extra residence clinics articles, medical images, stamp vignettes, and other materials. Dr. William Lanier, Editor-in-Chief of Mayo Clinic Proceedings, the entire editorial board, and I sincerely hope that you will enjoy these and the other outstanding articles in the August 2012 issue of our journal. We do thank you for your interest in and continued loyalty to Mayo Clinic Proceedings, and we are grateful for your ongoing support of our journal's mission to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. Once again, we have fascinating material lined up for the upcoming issues. For example, the September issue of Mayo Clinic Proceedings will contain articles on murder and euthanasia accusations against physicians, suicide in the U.S. Army, and HIV screening in the healthcare setting, status, barriers, and potential solutions. Our September issue will go live on Science Direct on September 4th and on our own website on September 6, 2012. Please check back on that date to hear the multimedia summary of highlights from that issue.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.